Mr. President, I rise this evening to talk about childcare. In particular, one piece of legislation which I've introduced today, but also to talk more broadly about the critical need in our country for more options, more opportunities for families, especially low-income families, to be able to afford childcare, and not just to afford any childcare, but childcare that is of a high quality. The bill that we're introducing today, we just introduced today, I should say, is the Child Care Access to Resources for Early Learning Act. And of course, we have an acronym. And of course, the shorthand for the bill is Child Care, C-A-R-E, standing for the words in the bill that focus on resources, and in particular, resources for early learning. It's my belief, and I think the evidence is abundantly clear over time, whenever this issue is studied in terms of the positive impact of early care and learning on a child, the evidence tells us over and over again that if kids learn more now, they're going to literally earn more later. And that connection between learning and earning is very compelling, and I think it's an essential part of the debate we have to have here when it comes to not just the education or early education and care for a young child, but the impact that has on all of our lives when it comes to the economy. So high quality early learning, we know now from the evidence, contributes to a reduction in the need for special education. It also helps to lower juvenile justice rates. It also helps to improve health outcomes over time. It also increases high school graduation and college matriculation rates. And for some children from low-income households, a lot of these studies have also shown that by the age of 3, they will have heard 30 million fewer words. 30 million fewer words than their more affluent peers. So even before they enter kindergarten, this so-called word gap means that they're already far behind. So depending on where the income level of the house can often determine how many words that child has heard in his or her life. The reason why it's such a big number, of course, is because the words get repeated. But even when you factor in the repeating of words over and over again, just imagine how far behind they are if they're behind by 30 million words. If it were 5 million words, that would be a substantial gap. But of course, it's much worse than that. I believe, and I think the evidence shows, that in the decades to come, the strength of our economy and the fiscal stability of our nation will depend on the viability and vitality of our future workforce. That's, I think, evident from the research. But again, that connection between early learning and the earning potential of that individual is abundant. Unfortunately, for many families, the need is still substantially great. Just last fall, Pennsylvania alone had a waiting list of 7,000 families who qualified for child care vouchers but did not receive them. In other words, one state, 7,000 families who were eligible for these vouchers and did not receive them. The story, unfortunately, is playing out across the country. According to data from the Department of Health and Human Services, less than 1 in 10 eligible children nationwide under the age of 4 receive child care assistance. In Pennsylvania, it's about 15%. So just think about that. 1 in 10 nationwide eligible for this kind of help are not receiving it. According to Child Care Aware, one of the many groups that helped with the legislation I just mentioned, the Child Care Act, they tell us that particularly in urban and rural communities, there is a severe shortage of high quality or licensed child care facilities. In Pennsylvania, where we have a significant state investment in child care, only 3.5% of child care slots for children birth to age 4 years old are in the highest quality programs. For many families who can even find care, the cost is very burdensome. For most families, childcare is often the second most costly expense behind only housing. Just imagine that. The second highest expense in the life of a family for far too many families is childcare, second only to housing. In 2014, in more than half of the United States, a year of childcare costs more than a year of college tuition at a public college. That is another stunning comparison. We hear it all the time from real people, not just numbers or studies. We hear it from real people. Last week when we were discussing the bill, the Child Care Act, we heard from a Washington, D.C. Metropolitan Police officer who also happens to be a parent. Her name is Zenobia, and she told us how much there is a struggle for hardworking, even middle-class families who just want the best for their children, how difficult that struggle is to find quality, affordable child care for early care and learning. This police officer also told me and told those in the room how all too often she sees in her work as a police officer teenagers or young people that did not have the benefit of high-quality care and early learning. Here's another example from Pennsylvania. Deanna, a parent, tells us, and I'm quoting just in part here, she said, "Each month with 2 children in daycare, our payment exceeded our mortgage payment." So not the second highest cost, but the highest cost in her household. Deanna goes on to say, "Some months we paid for daycare with our home equity line of credit. It took us 2 years to pay off the debt we acquired. Parents with young children are really struggling. It's a no-win situation," unquote. That's what Deanna, a parent from Pennsylvania, tells us. Christina, another Pennsylvanian, a parent, told us of the cost of daycare, quote, "Daycare is bringing us straight to foreclosure because we cannot afford our mortgage, groceries, diapers, and gas for our one car," unquote. So this is the real world, and this is the real life of families struggling, but especially struggling even in a recovery with the cost of child care. So let me talk for a moment just about the component parts of the Act. The Child Care Act is legislation that will ensure that families with infants and toddlers who are living at or below 200% of the federal poverty level, which we know is approximately $40,000 for a family of 3, it will help those families who need child care that they have access to that high-quality care. The Act will further the purposes of the Child Care and Development Block Grant by raising quality standards and by providing resources necessary to make those higher quality standards a reality and available to families across the nation. Over a 10-year period, we estimate that the legislation could help over 1 million additional children under the age of 4 gain access to high-quality child care. Part of achieving higher quality care is ensuring that child care providers are receiving an appropriate level of support, and the child care workers are compensated fairly for their expertise. Unfortunately, across the nation, the average child care worker often makes below poverty wages. According to the 2013 National Survey of Early Care and Education, the median wage for center-based child care staff was $9.30 an hour, about $19,000 a year. Just imagine that. The people that we believe are the best qualified and the most dedicated to taking care of our children, who will give them that early care and the learning that goes with it. The people that we say we invest our most treasured asset, our children, those in too many places in the country, those same workers are making just $19,000 a year. This means that child care workers on average make less than parking lot attendants, less than manicurists, less than massage therapists. So if we really care about our children, I think we would pay them more than some of the occupations I just mentioned. Caring for and nurturing infants and toddlers requires specialized knowledge and competencies that are not easily developed and should not be taken for granted. I believe, and I think most members of Congress, either in the Senate or in the House, believe that our children deserve quality. They deserve quality care and learning, but they especially deserve the quality that comes with someone who is paid an adequate wage and has a level of expertise and competency to provide that child with the kind of early care and learning that she has a right to expect. Child care funding is critically important, not only to families in Pennsylvania and across the nation, but of course it's critical if we're going to meet that demand that our workforce must meet. The children who learn more now will earn more later. We also know that this legislation is an opportunity to make, finally, at long last, that historic commitment to these same families. We know the return on investment, if that's all someone wants to focus on, is return on investment. I know some people like numbers sometimes better than testimonials from parents. But if your only concern is return on investment, this is a good deal. Return on investment, when in terms of high quality early care and learning, as high as $17 for $1. That's a pretty good deal anywhere in the country. We want to emphasize the return on investment, but I also believe at the same time we have to focus on the life of that child and that child's prospects for future employment to contribute to our economy. But we've got to make this issue a priority. If we really care about economic growth and GDP growth and competing in a world economy and having a skilled workforce, all those high aspirations, all those goals that we talk about a lot, it starts with early care and learning. A child cannot earn what she should be able to earn if she doesn't have the opportunity for early care and learning, high quality early care and learning. We can spend up to $40,000 a year on incarceration and thousands on drug treatment or special education, or we can spend a small fraction of that now on early care and learning and give children both a healthy and a smart start in life. So I'd urge my colleagues when it comes before them to support the Child Care Act that's been introduced today. Mr. President, let me conclude with just some brief comments about another related issue for our kids, lead poisoning. What has happened in Flint, Michigan is both horrific and inexcusable. No one should accept any excuse for what happened there. I want to commend Senator Stabenow and Senator Peters for shining a light on what occurred in their home state. But unfortunately, this is an issue that involves not just the state of Michigan, not just the city of Flint. This is a nationwide problem, especially on the eastern seaboard. Unfortunately, many communities around the country have numbers that are even worse, higher than the Flint numbers. Just by one example, Pennsylvania, one of the largest states in the Union. Here are the numbers there. 18 cities in Pennsylvania reporting higher levels of lead exposure among children than Flint. Let me say that again, higher levels than Flint. In Flint, 3.2% of children exceeded the danger threshold for lead exposure. Tested levels of 5 or more micrograms per deciliter of blood. So that 5 or more micrograms is the danger level. Flint was at 3.2. Where were some cities in Pennsylvania, as I said, having higher numbers? So instead of being at 5 or 3.2, here's what we see in Pennsylvania. Allentown, 23. Altoona, 20.5. My hometown of Scranton, 20%. Philadelphia and Pittsburgh, our largest cities, the two largest cities, the most urban parts of our state, were at 10 and 8 respectively. Lower than the other Pennsylvania cities, but still higher than Flint. In Pennsylvania, the primary source for childhood lead poisoning is not water, but rather deteriorating infrastructure and exposure to the remnants of lead-based paint and paint dust and chips. So that's a problem in our state, but there are other states, especially on the eastern seaboard, that have a similar problem. So we must ensure that children who've been exposed to high levels of lead receive all of, and I mean that literally, all of the follow-up services they need to reach their full potential, whether that's remedial or medical or educational. We need to be there for those children. So I've supported funding for the Centers for Disease Control's Healthy Homes and Lead Poisoning Prevention Program, which supports state and local public health departments working in identifying cases of childhood lead exposure, but that is just but one step. We have a lot more to do on this issue. So, Mr. President, I'll conclude this way. We should take action on child care to make sure it's affordable and it's of a high quality, so especially poor children can learn more now and earn more later. And it's very difficult to learn and to grow and succeed if you have the disadvantage not only of not having the kind of child care and early learning, but the additional burden of high levels of lead. These are challenges that we face as a country, and these are challenges that both houses and both parties must confront. Mr. President, I would yield the floor.